Good afternoon, everyone. Wynn Brown here with the Haywood Healthcare COVID-19 update for the week of July 10. This is, again, our weekly summary coming to you, both with American Sign Language and Spanish translation to make sure that everybody in our community has access to the information. Let's first go right to our testing. We have tested 9,437 individuals with 8,405 negative results. 516 positive, 87 indeterminate, putting our cumulative rate at 5.7% positive versus the state at 9.5%. Our 7-day rolling average is 0.13%, which is fantastic, versus the state at 2.0. So let's make sure we continue to do all the proper social distancing and hygiene things we can do so that we can avoid the resurgence of the pandemic like the South is seeing right now. Northern New England is doing very well because of all the things that we're doing to end our slow reopening. We are in phase 3 right now of the reopening, and I'll talk a little bit about that in a second. Worcester County has seen a total of 12,562 cases, and Franklin at 376. At Haywood Hospital, we have 1 positive patient in the hospital and 5 patients under an investigation, and we're awaiting their test results. Again, we are being challenged like everywhere else in New England right now to get our turnaround times back to where they were for testing results from our reference lab. But as you can imagine, the surge in the South is taxing all reference labs, and we use LabCorp, which is one of the largest national testing labs, and our tests go to New Jersey, and a lot of the southern states are also sending their reference work there. So luckily, we are on the verge of having COVID-19 testing in-house in the next couple of weeks, and that will give us greater control and quicker turnaround time, and I appreciate all the strong work our lab is doing to prepare for that. Just some announcements. I did mention we are in phase 3 of the reopening, and so that means that higher risk businesses are coming online, including movie theaters, outdoor performance venues, museums, historic sites, fitness centers. Our fitness center at Haywood Healthcare is open, and remember that we have no more than 4 people in there at a time. You need to sign in and sign out and do the cleaning that you need to do of the equipment so we can keep that open. And then just sports teams are coming back as well, although I don't think they're going to have much of an audience in person. And you can see the step-by-step phase 3 information at mass.gov/reopening. And again, just make sure you're taking proper precautions when you're entering businesses and making sure you're using that proper hand hygiene as well. Food access is an issue for our region all the time, but also during this pandemic. And just want to let you know that there is a federally funded community nutrition outreach program called Summer Eats for anyone under the age of 18 who would like free breakfast and lunch Monday through Friday. No proof of age or income is required, and it's delivered in several communities and locations, including Gardner and surrounding towns. And so there's a link here, mealsforkids.org/find-a-summer-meal site, and you can take advantage of that. Also, the United Way Youth Venture of North Central Maine, North Central, I'm from Maine, so of course I said North Central Maine, North Central Massachusetts Changemaker Series. Jacob Vanillo, United Way Youth Venture Outreach Specialist, has created a Changemaker series, which has a series of short videos for kids of all ages who can watch videos on providing coping skills, social support, fun activities, and more. You can find that on the Facebook site, and the link is right here with this update. Our annual Ride for Life motorcycle ride, unfortunately, is going to be virtual this year, but there's ways to take care of that, and the registration is free, but there are sponsorship opportunities out there, and people will be able to ride between August 1 and August 8, and there will be more information on this next week for those of you who want to participate. Also, our Watkins Faust golf outing is a virtual format as well. We have new sponsors: an Eagle sponsor, Hub International of New England, and T sponsors, Dr. Sheila Donnelly, a sponsor in honor of Peg Miller, and Dr. John and Brenda Skripczak as well are new sponsors. You can visit the link here to participate in that as well, and just click right on it. Some reminders for staff and for the community. We have counseling resources available. The Quabbin Retreat is accepting new patients. Both on-site and virtual counseling is available, as is on the Haywood campus. Our partial hospital program is available. And so please check out those resources if those are something that you or your patients or anyone in the community wants to take advantage of there. And then just finally, safe care here. That's our theme, and you'll see it up on some billboards and in our advertising and our marketing to let you know that you shouldn't hesitate to seek care if you are sick or want to schedule your well visits, and including our pediatric patients who need to get their immunizations on schedule. Please do not put those off. Our commitment continues to your health, safety, and well-being, and we are equipped to provide safe, comfortable, and accessible care on our campuses, and you can visit haywood.org/safe-care here for more information. And just to thank you, we had visitors at Athol Hospital yesterday. Christopher and Vicky Chi came to visit. Christopher's father, Dr. Youngmin Chi, was a beloved general surgeon at Athol from 1976 to 2001, and they came to see the new Hillis addition on our campus, and we thank them for joining us and supporting Athol Hospital during that visit as well. So that's the update for this week. I hope you all have a great weekend. Be safe out there. Get some time to be with your family and get outdoors. And I will be back to you next week, if not before, with an update on all that's going on with Haywood Healthcare. Thank you for all you're doing as we continue our journey to be one of the best community-owned health systems in America. Take care.